What is tinnitus? Tinnitus is a condition characterized by the perception of noise or ringing in the ears when no external sound source is present. It is often described as a persistent, high-pitched ringing sound. But it can also manifest as buzzing, humming, hissing, whistling, or other similar noises. Tinnitus is not a disease itself but rather a symptom of an underlying issue. The condition can be either subjective or objective. Subjective tinnitus: this is the most common type of tinnitus and occurs when only the person experiencing it can hear the sounds. It is often associated with damage to the hair cells in the inner ear, which are responsible for converting sound vibrations into electrical signals that the brain interprets as sound. Objective tinnitus: in rare cases, a healthcare provider may be able to hear the tinnitus sound during an examination. Objective tinnitus is often related to muscular or vascular issues near the ear, and the sounds may be produced by movements in the body, blood flow, or other physical factors. Tinnitus can have various underlying causes, including 1. Hearing loss. Age-related hearing loss, noise-induced hearing loss, or other auditory problems can trigger tinnitus. 2. Exposure to loud noises. Prolonged exposure to loud sounds or sudden exposure to extremely loud noises can lead to tinnitus. 3. Earwax blockage. Excessive earwax can cause irritation and tinnitus. 4. Ear and sinus infections. Infections can create inflammation and affect the auditory system. 5. Certain medications. Some medications can be ototoxic, harmful to the ears, and cause tinnitus as a side effect. 6. Head and neck injuries. Traumatic injuries can damage the auditory system and result in tinnitus. 7. Medical conditions. Tinnitus may be associated with conditions like Meniere's disease, temporomandibular joint (TMJ) disorders, and certain neurological conditions. Tinnitus can be temporary or chronic, and its impact on a person's life varies widely. While some individuals may experience mild annoyance, others can find it significantly disrupts their daily activities and quality of life. What kind of tinnitus noise is one hear? Tinnitus can manifest as a wide range of noises, and the type of sound a person hears can vary from one individual to another. Tinnitus sounds can be perceived in one ear, unilateral, or both ears, bilateral. Some common types of tinnitus noises include 1. Ringing. A high-pitched ringing sound is one of the most common types of tinnitus. It is often described as a continuous or intermittent tone resembling the sound of a ringing bell. 2. Buzzing. Tinnitus may present as a buzzing sound, similar to the sound of an electric current or a bee buzzing. 3. Hissing. Some individuals experience tinnitus as a hissing sound, similar to the sound of air escaping from a pressurized container. 4. Whistling. Tinnitus can manifest as a whistling sound, resembling the sound of a tea kettle or a distant whistle. 5. Clicking. Clicking tinnitus is characterized by rhythmic or irregular clicking sounds in the ear. 6. Pulsatil. This type of tinnitus is often described as a rhythmic pulsing or throbbing sound that is in sync with the person's heartbeat. It is more commonly associated with vascular issues. 7. Roaring or pulsing. Some individuals may perceive tinnitus as a roaring or pulsing sound, similar to the sound of ocean waves or a heartbeat. 8. Musical tones or melodies. Rarely, individuals with tinnitus may experience musical hallucinations, perceiving complex musical tones or melodies. It's important to note that tinnitus sounds are phantom sounds, meaning they are perceived by the individual but have no external source. Tinnitus sounds can vary in loudness and intensity and may be constant or intermittent. The specific type of tinnitus noise experienced by an individual can provide some clues to the underlying cause. But it is essential to undergo a comprehensive evaluation by a healthcare professional, preferably an ear, nose, and throat (ENT) specialist or an audiologist, to determine the cause and appropriate management strategies for the tinnitus. Is tinnitus common? Yes, tinnitus is relatively common, affecting a significant number of people worldwide. The prevalence of tinnitus can vary depending on the population studied and the criteria used to define the condition. According to various studies and estimates, 1. In the general population, it is reported that around 10% to 20% of adults experience tinnitus at some point in their lives. However, not all cases are chronic or severe. 2. Among older adults, tinnitus becomes more prevalent with age, and its occurrence increases in older populations. Around 25% to 30% of older adults may experience tinnitus. 3. Veterans and military personnel. Tinnitus is quite common among veterans and military personnel, especially those who have been exposed to loud noises or explosions during their service. 4. Individuals with hearing loss. Tinnitus is often associated with hearing loss, and it's estimated that around 70% to 90% of people with hearing loss also experience tinnitus. While tinnitus can affect people of all ages, it becomes more prevalent as individuals get older or are exposed to risk factors like loud noises and certain medical conditions. It's important to note that tinnitus can vary in severity and impact from person to person. For some, it may be a minor annoyance that comes and goes, while for others, it can significantly affect their daily life, sleep, concentration, and emotional well-being. As tinnitus is a prevalent condition, ongoing research is focused on understanding its causes, potential treatments, and ways to manage its impact on affected individuals. What are the first signs of tinnitus? The first signs of tinnitus can vary from person to person, but they typically involve the perception of sound in the ears or head when no external sound source is present. Here are some common early signs of tinnitus. 1. Ringing or buzzing sound. The most common and recognizable sign of tinnitus is the perception of a ringing or buzzing sound in the ears. This sound can be constant or intermittent and may vary in intensity. 2. High-pitched noises. The tinnitus sound is often described as a high-pitched tone, but it can also manifest as other noises like humming, hissing, whistling, or clicking. 3. Unilateral or bilateral. Tinnitus can affect one ear, unilateral, or both ears, bilateral. Unilateral tinnitus may be an indication of an issue specific to the affected ear, while bilateral tinnitus can be related to problems in the auditory system. 4. Intermittent or continuous. Tinnitus can come and go, or it can be present continuously. Some people experience tinnitus only in certain situations, such as in quiet environments or when they are tired. 5. Associated with certain triggers. Tinnitus may be triggered or worsened by certain factors, such as exposure to loud noises, stress, caffeine, alcohol, or certain medications. 6. Hearing difficulties. Tinnitus is often associated with hearing loss or changes in hearing ability. In some cases, people may notice a decline in their hearing before or alongside the onset of tinnitus. 7. Emotional impact. Tinnitus can cause emotional distress, anxiety, and difficulty concentrating, especially if the sound is bothersome and persistent. 8. Sleep disturbances. Tinnitus can interfere with sleep, making it challenging to fall asleep or stay asleep. It's important to note that tinnitus can have various underlying causes, and experiencing any of the above signs does not necessarily mean you have tinnitus. What causes tinnitus? Tinnitus can be caused by a wide range of factors, and in many cases, it is associated with damage to the auditory system. Below are some common causes and contributing factors of tinnitus. 1. Noise-induced hearing loss. Prolonged exposure to loud noises, such as loud music, machinery, firearms, or explosions, can damage the hair cells in the inner ear. This damage can lead to hearing loss and tinnitus. 2. Age-related hearing loss. As people age, there is a natural degeneration of the auditory system, including the hair cells in the inner ear. Presbycusis. 3. Age-related hearing loss. Presbycusis can be a factor in the development of tinnitus, especially in older individuals. 4. Earwax blockage. Excessive earwax accumulation can irritate the ear canal and cause tinnitus symptoms. 5. Ototoxic medications. Some medications, such as certain antibiotics, diuretics, nonsteroidal anti-inflammatory drugs, NSAIDs, and chemotherapy drugs, can be ototoxic and cause tinnitus as a side effect. 6. Ear and sinus infections. Infections in the ear or sinuses can lead to inflammation and affect the auditory system, resulting in tinnitus. 7. Injuries and trauma. Head or neck injuries can damage the auditory system and cause tinnitus. 8. Medical conditions. Certain medical conditions and disorders, such as Meniere's disease, a disorder of the inner ear, temporomandibular joint, TMJ, disorders, acoustic neuroma, a non-cancerous tumor on the cranial nerve, and high blood pressure, may be associated with tinnitus. 9. Vascular issues, changes in blood flow and circulation near the ear can cause objective tinnitus. Tinnitus that can be heard by a healthcare provider during an examination. 10. Stress and anxiety, emotional stress and anxiety can exacerbate the perception of tinnitus or make individuals more aware of the tinnitus sounds. 11. Neurological disorders. Some neurological conditions, such as multiple sclerosis, can be linked to tinnitus. It's important to recognize that tinnitus is a symptom rather than a disease itself, and its specific cause may vary from person to person. In some cases, tinnitus may be a result of a combination of factors. What are the complications of tinnitus? Tinnitus itself is not a life-threatening condition, but it can lead to various complications and significantly impact a person's quality of life. The severity of complications can vary depending on the individual, the underlying cause of tinnitus, and how well it is managed. Some potential complications of tinnitus include: 1. Sleep disturbances. Tinnitus can make it challenging to fall asleep or stay asleep, leading to sleep disturbances and insomnia. Lack of adequate sleep can negatively affect overall health and well-being. 2. Emotional distress and anxiety. Persistent tinnitus can cause emotional distress, anxiety, and frustration. The constant perception of sound, especially if it is bothersome, can lead to feelings of helplessness and sadness. 3. Depression. In some cases, tinnitus can contribute to the development of depression, particularly if it significantly impacts a person's daily life and sense of well-being. 4. Difficulty concentrating and cognitive issues. Tinnitus can make it hard to concentrate on tasks, which may affect work, studying, or other activities that require focus and attention. 5. Social withdrawal and isolation. Severe tinnitus can lead to social withdrawal, as individuals may avoid social situations or noisy environments to escape the exacerbation of their symptoms. 6. Hearing difficulties. Tinnitus is often associated with hearing loss. The combination of tinnitus and hearing impairment can make communication and understanding speech more challenging. 7. Negative impact on relationships. Tinnitus can put strain on relationships, as affected individuals may become irritable or less engaged in social interactions due to their condition. 8. Decreased productivity at work. Tinnitus-related difficulties with concentration and sleep can lead to reduced productivity in the workplace. 9. Tinnitus-related distress. The constant presence of tinnitus can cause distress, which may create a cycle of stress amplifying the perception of the tinnitus sound. Worsening of underlying conditions. In cases where tinnitus is a symptom of an underlying medical condition, failure to address the root cause may result in the exacerbation of that condition. It's important for individuals experiencing tinnitus to seek medical evaluation and appropriate management to minimize the potential complications. Various treatments and coping strategies, such as sound therapy, counseling, relaxation techniques, and hearing aids, can help individuals better manage tinnitus and improve their overall well-being. Early intervention and support are crucial in addressing the emotional and functional impact of tinnitus on a person's life. Can tinnitus be a sign of a serious medical condition? Yes, in some cases, tinnitus can be a sign of an underlying and potentially serious medical condition. While tinnitus itself is a symptom and not a disease, it can serve as a warning sign that something else may be going on in the body. Therefore, it is essential to pay attention to any changes in your hearing or the presence of tinnitus and seek medical evaluation to identify the underlying cause. Some medical conditions associated with tinnitus include: 1. Hearing loss. Tinnitus is often linked to hearing loss, which can result from various factors, including noise exposure, age-related degeneration, or certain medical conditions. 2. Meniere's disease. This inner ear disorder can cause episodes of vertigo, hearing loss, and tinnitus. 3. Acoustic neuroma. This is a non-cancerous tumor that grows on the vestibular nerve, which is responsible for transmitting balance and sound information from the inner ear to the brain. Acoustic neuromas can cause tinnitus, hearing loss, and balance problems. 4. Head and neck injuries. Traumatic injuries to the head or neck can damage the auditory system and lead to tinnitus. 5. TMJ disorders. Problems with the temporomandibular joint, TMJ, which connects the jaw to the skull, can cause tinnitus and other symptoms. 6. Vascular disorders. Changes in blood flow and circulation near the ear can lead to objective tinnitus, tinnitus that can be heard by a healthcare provider during an examination. 7. High blood pressure. Uncontrolled hypertension may be associated with tinnitus. 8. Ototoxic medications. Some medications can cause tinnitus as a side effect, and in some cases, this can be an indication of potential damage to the auditory system. 9. Thyroid disorders. Certain thyroid conditions may be linked to tinnitus. It's important to note that while tinnitus can be associated with these serious medical conditions, the majority of tinnitus cases are not life-threatening and can be managed effectively with appropriate interventions. Does tinnitus ever go away? Tinnitus can go away in some cases, but it is highly variable and depends on the underlying cause and individual factors. For some people, tinnitus may be temporary and resolve on its own, while for others, it may persist or become a chronic condition. Here are some scenarios in which tinnitus may go away. 1. Temporary triggers. If tinnitus is caused by a temporary trigger, such as exposure to loud noise or certain medications, the symptoms may improve or disappear once the trigger is removed or the medication is discontinued. 2. Earwax removal. In cases where tinnitus is caused by excessive earwax blocking the ear canal, the removal of the earwax can alleviate the symptoms. 3. Acute infections. Tinnitus related to ear or sinus infections may improve or resolve with appropriate medical treatment and recovery from the infection. 4. Stress-related tinnitus. If tinnitus is triggered or exacerbated by stress or anxiety, managing stress through relaxation techniques, counseling, or other stress reduction methods may lead to an improvement in symptoms. 5. Treatment of underlying medical conditions. When tinnitus is a symptom of an underlying medical condition, such as Meniere's disease or a thyroid disorder, treating the primary condition may help alleviate tinnitus. However, it's important to recognize that in many cases, tinnitus may be a chronic condition, especially if it is associated with age-related hearing loss, noise-induced hearing damage, or certain medical conditions that cannot be cured. In such cases, the focus shifts to managing and coping with the tinnitus effectively to improve the individual's quality of life. Treatment options for chronic tinnitus may include 1. Sound therapy, using background noise or white noise to mask the tinnitus sound and make it less noticeable. 2. Counseling. Working with a therapist or counselor to develop coping strategies and address emotional distress related to tinnitus. 3. Hearing aids. For individuals with hearing loss and tinnitus, hearing aids can help amplify external sounds and make tinnitus less noticeable. 4. Tinnitus retraining therapy, TRT. A therapeutic approach that aims to retrain the brain's response to tinnitus, reducing its impact over time. 5. Medications. In some cases, certain medications may be prescribed to help manage the effects of tinnitus. Remember that each case of tinnitus is unique, and what works for one person may not work for another. How tinnitus diagnosis is done by a medical practitioner. Diagnosing tinnitus typically involves a comprehensive evaluation by a medical practitioner, preferably an ear, nose, and throat, ENT, specialist or an audiologist. The process may include the following steps. 1. Medical history. The healthcare provider will begin by asking you about your medical history. including any previous or current medical conditions, medications you are taking, and any history of noise exposure or head/neck injuries. 2. Symptom assessment. You will be asked to describe your tinnitus symptoms in detail. The healthcare provider will inquire about the nature of the sound, its pitch and loudness, whether it's constant or intermittent, and if there are any specific triggers or factors that worsen or alleviate the tinnitus. 3. Physical examination. The healthcare provider will conduct a physical examination with a focus on the head, neck, and ears, to look for any visible abnormalities or signs of underlying conditions that may be contributing to tinnitus. 4. Hearing tests. Audiometric tests will be performed to evaluate your hearing ability and identify any hearing loss. Pure tone audiometry and other tests can help determine the type and degree of hearing loss, if present. 5. Tinnitus pitch and loudness matching. You may be asked to match the pitch and loudness of your tinnitus to external sounds played through headphones. This helps the healthcare provider understand the subjective perception of your tinnitus. 6. Imaging studies. In some cases, imaging studies like magnetic resonance imaging, MRI, may be ordered to rule out structural issues or tumors in the auditory system. 7. Questionnaires and psychological assessment. Some healthcare providers may use questionnaires or psychological assessments to evaluate the impact of tinnitus on your emotional well-being and quality of life. 8. Rule out underlying conditions. The healthcare provider will work to identify any underlying medical conditions or factors that may be contributing to your tinnitus. Diagnosis. Once the evaluation is complete, the healthcare provider will make a diagnosis and discuss the findings with you. If an underlying medical condition is identified, appropriate treatment or management options will be recommended. In cases of subjective idiopathic tinnitus, tinnitus without an identifiable cause, the focus will be on managing the symptoms and improving the individual's ability to cope with the condition. It's essential to be thorough during the diagnostic process to ensure an accurate understanding of the tinnitus and to develop an effective treatment plan. How do healthcare providers treat tinnitus? The treatment of tinnitus depends on the underlying cause, the severity of symptoms, and the impact on the individual's quality of life. As there is no one-size-fits-all approach, healthcare providers typically tailor the treatment to each patient's specific needs. Here are some common methods used to manage tinnitus. 1. Addressing the underlying cause. If tinnitus is a symptom of an underlying medical condition, the primary focus is on treating that condition. For example, if tinnitus is related to earwax blockage, removing the earwax can alleviate the symptoms. If it is caused by medication, discontinuing the medication or switching to an alternative may be recommended. 2. Sound therapy. Sound-based therapies aim to provide external noise to mask or distract from the tinnitus sound. This can include using white noise machines, fans, or specially designed sound generators that produce soothing sounds like ocean waves or rain. Hearing aids with built-in sound generators can also be used, especially in cases where tinnitus is associated with hearing loss. 3. Tinnitus retraining therapy, TRT. TRT is a therapeutic approach that combines sound therapy with counseling to help individuals habituate to the tinnitus sound over time. It aims to retrain the brain's response to tinnitus, making it less bothersome. 4. Counseling and education. Tinnitus can be emotionally distressing, and counseling can help individuals cope with the condition and develop strategies to manage stress and anxiety related to tinnitus. 5. Medications. There is no specific medication to cure tinnitus, but some medications may be prescribed to address associated symptoms like anxiety or depression. Certain medications, such as certain antidepressants or anti-anxiety drugs, can help improve the emotional well-being of individuals with tinnitus. 6. Relaxation techniques. Stress and anxiety can exacerbate tinnitus. Learning relaxation techniques such as deep breathing, meditation, or yoga can help individuals reduce stress levels and manage tinnitus-related distress. 7. Lifestyle changes. Avoiding loud noises and using hearing protection in noisy environments can help prevent further damage to the auditory system and reduce tinnitus symptoms. 8. Tinnitus apps and online resources. There are various smartphone apps and online tools that offer self-help techniques, sound therapy, and information about tinnitus management. It's important to note that while some treatments may not eliminate tinnitus completely, they can significantly improve the quality of life for individuals with tinnitus. Additionally, ongoing research is being conducted to develop new treatments and therapies for tinnitus. Could tinnitus cause hearing loss? Yes, tinnitus can be associated with hearing loss, and the two conditions are often interconnected. While tinnitus itself is the perception of sound in the ears or head, when no external sound source is present, hearing loss refers to a reduced ability to hear sounds. Both tinnitus and hearing loss can result from damage to the auditory system, particularly the hair cells in the inner ear. There are two main types of hearing loss associated with tinnitus. 1. Sensorineural hearing loss. This type of hearing loss occurs when there is damage to the hair cells in the cochlea of the inner ear or to the auditory nerve. Sensorineural hearing loss is the most common type linked to tinnitus. When these hair cells are damaged, they may send abnormal signals to the brain, leading to the perception of tinnitus. Noise-induced hearing loss, age-related hearing loss, and certain medical conditions are common causes of sensorineural hearing loss and tinnitus. 2. Conductive hearing loss. This type of hearing loss is caused by issues in the middle or outer ear that block or reduce the transmission of sound to the inner ear. While less commonly associated with tinnitus, conductive hearing loss can still contribute to or worsen existing tinnitus symptoms. It's essential to recognize that not everyone with tinnitus will experience hearing loss, and not everyone with hearing loss will have tinnitus. However, there is a significant overlap between the two conditions, and individuals with tinnitus should undergo a comprehensive hearing evaluation to assess their auditory function. What happens if I don't have a medical condition? If you experience tinnitus but do not have an underlying medical condition causing it, you may have what is commonly referred to as subjective idiopathic tinnitus. This means that the tinnitus is a symptom in itself and not linked to any specific medical condition or identifiable cause. Subjective idiopathic tinnitus is quite common, and it can be a challenging condition to diagnose and treat. Here's what can happen if you have tinnitus without an underlying medical condition. 1. Management and coping. Without a specific medical condition to treat, the focus shifts to managing and coping with tinnitus effectively. Healthcare providers may recommend various strategies to help you adapt to the presence of tinnitus and reduce its impact on your daily life. 2. Sound therapy. Sound-based therapies, such as using white noise or specialized tinnitus maskers, can be helpful in providing relief and making the tinnitus less noticeable. 3. Counseling and education. Counseling can be beneficial in helping you understand tinnitus, cope with any emotional distress it may cause, and develop relaxation techniques to reduce stress and anxiety related to tinnitus. 4. Lifestyle modifications. Adopting healthy lifestyle habits, such as reducing caffeine and alcohol consumption, avoiding exposure to loud noises, and managing stress, can be helpful in managing tinnitus. 5. Support groups. Joining support groups or online forums with others experiencing tinnitus can provide valuable emotional support and helpful tips for managing the condition. 6. Tinnitus retraining therapy, TRT. TRT can be considered for individuals with bothersome tinnitus, even without an identifiable cause. TRT aims to habituate the brain to the tinnitus sound, making it less bothersome over time. It's important to remember that while subjective idiopathic tinnitus may not have an underlying medical condition to address, it can still have a significant impact on your well-being. How can I prevent tinnitus? While it may not be possible to completely prevent all cases of tinnitus, there are several steps you can take to reduce your risk of developing tinnitus or to minimize its impact on your life. 1. Protect your ears from loud noises. Avoid prolonged exposure to loud noises, both at work and during recreational activities. When in noisy environments, use ear protection such as earplugs or earmuffs to reduce the risk of noise-induced hearing damage. 2. Keep the volume at a safe level. When listening to music or other audio through headphones or earbuds, keep the volume at a safe level. As a general rule, if others can hear the sound from your headphones, it's too loud. 3. Take breaks from noisy environments. If you work in a loud environment, take regular breaks in quieter areas to give your ears a rest from the noise. 4. Manage stress. Stress can exacerbate tinnitus. Practice stress reduction techniques such as meditation, yoga, deep breathing exercises, or engaging in activities that help you relax. 5. Limit caffeine and alcohol consumption. High caffeine and alcohol intake can worsen tinnitus symptoms in some individuals. Moderating your consumption of these substances may help reduce tinnitus discomfort. 6. Exercise regularly. Regular physical activity can improve blood circulation and promote overall health, which may be beneficial for managing tinnitus. 7. Maintain a healthy diet. Eating a balanced diet rich in nutrients can support overall well-being, including the health of your auditory system. 8. Avoid smoking and secondhand smoke. Smoking can have a negative impact on circulation and hearing health. Avoid smoking and minimize exposure to secondhand smoke. 9. Treat underlying medical conditions. Properly manage medical conditions like hypertension, diabetes, and other health issues to reduce the risk of tinnitus associated with these conditions. 10. Avoid ototoxic medications. Be aware of the potential side effects of certain medications, as some can be harmful to the ears and may cause tinnitus. Consult your doctor if you have concerns about medications you are taking. 11. Get regular checkups. Regular visits to your healthcare provider can help identify any potential health issues early, including those that might contribute to tinnitus. It's important to note that even with taking preventive measures, some individuals may still develop tinnitus due to factors beyond their control. If you experience tinnitus or any changes in your hearing, it's essential to seek evaluation from a healthcare professional, preferably an ear, nose, and throat (ENT) specialist or an audiologist, to determine the underlying cause and appropriate management strategies. Early intervention and proper care are vital in addressing tinnitus effectively.